Atropine, parasympatholytic, anticholinergic. Pharmacology and actions. Blocks acetylcholine receptor sites, thereby decreasing the action of the parasympathetic or cholinergic nerve fibers. It increases myocardial oxygen demand. It increases heart rate by blocking vagal influences at the SA node. It increases conduction through the AV node. Atropine also reduces motility and tone of the GI tract, and it reduces action and tone of the urinary bladder. It also dilates pupils and stops sludge. The onset of action is immediate. Indications for atropine. Hemodynamically significant bradycardias or heart blocks. Symptoms include altered mental status, hypotension, chest pain, pulmonary edema, and shortness of breath. It is the antidote for some insecticide exposures. It is also the antidote for nerve agents with sludge symptoms. It can be used as a pre-intubation for pediatrics under the age of 8. Contraindications for atropine include evolving MI and glaucoma. Precautions and side effects of atropine. Pediatric bradycardias are most commonly due to hypoxia. Give oxygen instead. Many people do well with chronic second and third degree heart blocks. Use atropine on hemodynamic parameters only. Paradoxical bradycardias may occur in children with doses less than 0.1 milligrams. Atropine also causes palpitations, headache, dizziness, blurred vision, dry mucus plugs, and acids may slow the absorption of anticholinergics. Atropine is also known to cause dry mouth and flushed, dry skin. The dosage of atropine is as follows. Symptomatic bradycardia, 0.5 milligrams IVIO or ET, repeated if needed at 5-minute intervals to a total max dose of 0.04 milligrams per kilogram, or stop at a ventricular rate of 60. ET administration. ET administration is 2 to 2.5 times the IV dose, using 0.4 milligram per milliliter, diluting with 10 milliliters of normal saline. It's also used for symptomatic insecticide exposures. Begin with 2 to 5 milligrams IVIMIO. Repeat with 2 to 5 milligrams if no improvement. Nerve agent exposures. 2 to 20 milligrams IVIMIO. Titrate to response. Pediatric dosing. Pre-intubation. Children under the age of 8 can receive 0.02 milligram per kilogram IVIO with a minimum single dose of 0.1 milligrams and a maximum single dose of 0.5 milligrams. It's used for symptomatic bradycardia. Its dose is 0.02 milligram per kilogram IVIO or ET. Minimum dose is 0.1 milligrams. The maximum dose is 0.5 milligrams. It can be used for symptomatic insecticide exposures. 0.05 milligram per kilogram IVIMIO. Repeat in 5 to 10 minutes with another 0.05 milligrams. House applied pre-filled syringe of 1 milligram and 10 milliliters. A multi-dose vial of 0.4 milligrams per milliliters, or 8 milligrams and 20 milliliters, or a 2 milligram auto-injector. Common household organophosphates include flea and tick collars, ant and roach sprays and traps, over-the-counter bug bombs, flea dips and sprays.